Dr. Elizabeth Miller is here. She is a dermatologist with the Austin Diagnostic Clinic. Weather's changing, skin is changing. It's a good time to focus on your skin and protecting your skin. Thank you for being here this morning.
Thank you for having me.
Oh, sure. And November is National Healthy Skin Month. So what should we be doing to make sure our skin is healthy?
Well, I think year-round, the most important thing is to protect your skin from excessive sun exposure and to avoid tanning booths.
Yeah, those are two very important ones. And the rules have changed a little bit about sunscreen. So talk about that. They changed this summer.
FDA has recently made new labeling guidelines. Now the SPF factor is required to provide both UVA and UVB protection. Previously, it was only required to document its UVB protection. So these new sunscreen labels, in order to say they are broad spectrum, they must provide equal UVA and UVB protection.
Now, we also have some tips we want to show our viewers this morning, just some other things you can do to protect your skin. Obviously, eat healthy. Of course, drinking water and eating greens and other healthy foods help to improve your skin.
Well, really the most important thing for skin health, like I said, is sun protection and also a daily moisturizer, and those two things can be combined. Many moisturizers now have an SPF value of 30 or greater, which is what I recommend you have for a daily protection on your face.
And one interesting tip that was at the bottom of the list I thought was interesting, not to touch your acne blemishes. What does that do for your skin if you're constantly bothering your skin?
Yes, well, if you touch your acne lesions, you bring a small amount of bacteria to the skin. Our hands have a lot of bacteria on them. You also manipulate the lesion itself, and that can make your body's own immune system more active at that site and make that spot more red and irritated, potentially leading to more scarring down the road.
And can you ever get rid of scarring if you have scarring on your skin?
Again, sun protection over time can help limit that discoloration some people develop after an acne lesion. But decreasing the manipulation and then providing sun protection afterwards are your two best defenses against a scar.
Also, too, lots of people sleep in their makeup. And I ask you that because there are certain makeups you can't sleep in and other makeups that are not good for your skin long term because your skin soaks it up. So can you address that a little bit?
Well, many makeup products these days are non-comedogenic, meaning they will not clog your pores. But that being said, I still recommend people wash their face with a non-drying cleanser twice a day and follow that with a moisturizer.
And do you have to spend a lot of money on just skincare products, or can you buy things from the grocery store?
Absolutely. I think the grocery store products are just as good. Everybody's got their own personal preference, and some products feel better than others. But in general, to provide the moisturization and sun protection, the over-the-counter Walgreens, HEB products are just fine.
Excellent. Well, if you'd like to make an appointment with Dr. Elizabeth Miller, you can find her at the Austin Diagnostic Clinic. Her phone number is 901-4054, and the web address is adclinic.com. You can make an appointment there. Thank you so much for being here.
Thank you for having me.
Good to see you.